This is me, scared to go to school at our home in Padibe, northern part of Uganda. Back then, life was all easy for me and my younger brother John. And when he could develop fever and difficulty in breathing, my mother could throw her on her back and walk with us 12 kilometers to the nearest health center. It's like walking from here to Wembley Stadium. But sadly, John died of cerebral malaria, and it's too late for him. But it's not too late for the other 100 million people in sub-Saharan Africa who live in rural, remote healthcare black holes. They have no good healthcare option. We can solve this problem. This inspired me to become a nurse and solve this problem. And 7 years ago, I met my good friend Nick, and we launched OneDay Health, our scalable healthcare architecture built in these 4 pillars.
Pillar number 1, our healthcare mapping technology. To solve this problem, we have to identify every community, every village with poor access to healthcare. So we built Health AIM, our AI-powered heat map, which lights up every healthcare black hole that needs a OneDay health centre. 2, we're comprehensive. Our OneDay health centres might be able to treat even more than your GP clinics here in London. We can treat acute conditions like malaria and pneumonia, chronic diseases like diabetes and high blood pressure, and we empower women's reproductive future through access to family care, to family planning and pregnancy care. 3rd, at the heart of what we do, we are high quality. Our custom-made guidelines and support supervision system make sure that every single patient is treated accurately, gets the right diagnosis, gets the right treatment. Finally, 4th pillar, we are cost effective. Each OneDay health centre costs only $4,000 to launch. And each patient visit, which includes a malaria test and a full course of medications, costs only $2. Our model, which is nurse-led, out of rental buildings, with our standardised care, might be one of the most cost-effective ways in the world to save a life right now.
In 2020, I met Akelo, a mother of a beautiful pair of twins. She said to me, before OneDay Health, we could die because the health center is too far away and it's hard to get transport means. But, tuodong pekoro, sickness doesn't wait. Then she said, now with OneDay Health, we can get quality treatment at affordable cost, and I have extra money to buy chickens and send my children at school. That is what we do. And just a week ago, we loaded a truck with furniture, medication, solar unit, and medications, and we launched our 49 OneDay Health centers with our wonderful nurse, Agnes. Maybe number 50 is happening right now.
And we're proud that over the last 7 years, our talented nurses, our 55 talented nurses, have treated 280,000 patients, including 130 patients with the deadly condition of malaria. We've cared for 100,000 vulnerable children under 5 and saved Ugandan communities $500,000 in transport costs. That's the equivalent of putting $15 million of purchasing power back in the pockets of some of the poorest people on earth. And we're ready to ramp this up next year. Next year, we're planning to launch 25 more OneDay health centres in Uganda, and for the first time, expand to another country in Malawi. We can solve this remote rural healthcare problem. We have the mapping technology to identify every last healthcare black hole, and we have the healthcare architecture which can rapidly scale and give everyone in a remote rural healthcare black hole the same treatment we've already provided for 280,000 people in Uganda.
Today, we want to ask you for 2 things. 1, with $500,000, we can be able to build Health AIM and map out every country in sub-Saharan Africa. And then we can be able to see every healthcare black holes. Number 2, help us to get into the place where things happen. Get us there where things are happening or where things can happen. Connect us with the government ministries, with somebody you know. Connect us there. Maybe you have a friend in Malawi or Tanzania government. Give me their phone numbers.
Or just give us their phone, Kieran, that would also work.
People often talk of universal healthcare with no clear plan to reach to the last 5%, the last mile people. We have the solution. And with every OneDay health facility, we are coming closer to our dream that one day, everyone across sub-Saharan Africa will have access to high-quality, comprehensive healthcare. And people like my brother John will not suffer again. Thank you.